came home and I told my husband, I said, I need help. And I don't know what kind of help I need, but I need some sort of help. And I know I feel isolated and I feel like I'm alone in these feelings, but I know I'm not.
Mhm.
So when I started this group, I mean, all of us were having the same conflicting feelings, the same burnout, the same, there was a lot of camaraderie behind it. And so when Liz and I started talking about these things, I said, we both said to each other, okay, we're talking about everything that's wrong, but how are we going to fix it? How are things going to get better if we're not creating solutions? And we're both very solutions oriented, and we're not the type of people that are just like complaining without bringing a solution. So that's where WMC PhD was born.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 43. Hi everyone, Omari Richards here. Thank you all so much for joining me once again to listen to a wonderful public health career story. Before we get into anything, definitely make sure that you subscribe, like, leave a review, share this with a friend. I greatly appreciate that, and it helps me get this show in front of more people, so I appreciate that. Today's episode is exciting for myself because it's a great episode just hearing a public health story, as well as we get a dig into WMC Public Health Consulting. I spoke to one of the co-founders early on, Liz Simpler, in episode 24. So check that episode out. But today we get to hear from the co-founder and hear her story, as well as the evolution of WMC Public Health Consulting and what they have been up to since I last spoke to the other co-founder. So it's definitely insightful information in this episode, and I hope that you all enjoy. Without further ado, here's today's episode. Today, we have a public health professional with a strong background in higher education in the healthcare field. She got her Bachelors of Science in Health Sciences at La Sierra University. She has gotten her Master of Public Health at the Grand Canyon University. She has had various admission roles after her bachelor's up until now. She has also got a holistic nutrition coach, functional medicine at the Institute for Integrative Nutrition. Additionally, she is the founder and CEO of WMC Public Health Consulting, where they engage in corporate wellness and wellness accessibility for working mothers. Check them out at workingmama.co on Instagram. She also currently works as a business development representative at West Coast University. We have Giana Vasconcellos, MPH CHHS. Welcome to the show.
Hello, thank you.
Yeah, pleasure. I'm glad to get you on the show. I know we had your other counterparts, Liz, on the show a couple months, weeks back.
Yeah.
And I'm glad we get to hear your part of your story now. So how have you been doing? How have you been coping during these times?
It's been interesting, I think, to say the least. We've definitely had to pivot in a professional way and in a personal family life way. My husband's a nurse, so he's on the front lines, constantly exposed and working overtime sometimes. So it's been pretty challenging. I'm home, obviously, with now two kids. I just had a baby, so it's an interesting time, but I feel like it's brought a lot of real life moments to the forefront that a lot of people, we were able to or we were meeting this expectation of having to hide those real life moments and leave your life at the door, but it's really putting in front of people professionally and personally that life isn't left at the door. It's just kind of going on as we clock in and clock out. So it's a fun experience.
Yeah, and that definitely with the pandemic has made it kind of
Yes,
hard to but it blended those lines of like work and personal life. So
for sure.
congratulations on the baby also.
Thank you.
How has that been like giving birth during the pandemic and everything?
Oh man, that is a whole conversation, but I'll wrap it up nicely for you. I think that I had a hospital birth my first time around almost 6 years ago. And this time around, I was going through a standard obstetrician's office, but about halfway through my pregnancy, there was a lot of, that was about mid 2020 when things started getting shut down. There were a lot of questions that weren't able to be answered by my providers, and I'm pretty sure it was across the board for a lot of providers. So my husband and I started exploring the option of home birth, and we interviewed a slew of licensed midwives, and we just found the perfect team and decided to go with that. And it was just an amazing experience. We felt so safe. We felt advocated for, and we were home. So it was awesome.
That is awesome, and I definitely would like to loop back and have a conversation around that later on, if you don't mind.
Oh, for sure.
Okay, awesome. So how do you identify, and then tell us a little about your personal background?
So I mean, my name is Giana. Most everyone calls me Giana, but G or Gigi is kind of making a comeback. My professional background is I started out with an undecided major. I had no idea what I wanted to do. I started at PCC, Pasadena City College in Los Angeles, and I knew I wanted to do something in the healthcare field. Nutrition was definitely on the highlight of my interest. And then I actually had an interest in nursing. I wanted to be a labor and delivery nurse. And then kind of as we went through, I found I wasn't very interested in chemistry and organic chemistry, which was like primarily some of the classes that I had to take. And being the young 19, 20-year-old, I was like, I don't like chemistry. I'm not going to take it. So I'm going to change my major. So mature of me. So I decided to go into the health and wellness sphere, and I found I liked that a little bit more with my major because I was getting a mixture of not just health classes and biology and anatomy and physio, which I really, really love, but I was also getting some of the psychology background to it because, you know, they're totally holistic. They go hand in hand. So it kind of carried me through my last major. So that was my fifth major throughout college. And I knew I kind of, you know, got into the interest of maternal health and childbirth education, which was something that I actually loved since I was very young, but I didn't really know of how I could tie that into my career professionally. So that's kind of the timeline of my majors professionally. The education piece, because I have worked for higher education for a long time, I was actually I fell into that. And I really don't like to say that because I feel like when you make decisions intentionally or unintentionally, you're not just falling into something, you just, you know, you're deciding. So I kind of fell into that back in 2012 when I saw a job posting. I wanted to help other people find their career paths. And I wasn't really sure. I was going through a big life change at the time. I had moved out of state and I was moving back. And that's when I started at West Coast University. And I met some of my best friends there working there. And so it was very hard for me to leave. Obviously, I'm still there. And yeah, like I just started growing. I've had 3 roles there now, and it's been safe. It feels safe. It feels easy. I know the culture. I know the company very well. So yeah, so that's where I am right now. And then I don't know, the way that WMC came was it came out of a personal need. Uh, it was it was very close to my heart to reach out to other working moms that were suffering in the wellness department because I was my own audience. And I felt like it was a very, honey.
Where's my vitamins?
Daddy knows. Sorry.
You're absolutely fine. Just so everyone
My
knows, Giana has a kids, and this is absolutely fine.
my 5-year-old just asked me where my vitamins were. And then our 90-pound dog just rushed in. So that's where we're at right now. Yeah, so WMC came because it was a personal need for me. And I really felt like I wasn't the only one. And it felt very isolating to be a working mom and suffer from anxiety and suffer from barely eating and just living on caffeine and coffee, and just I was kind of thrown into that, and I created the Facebook group, and then that's where it really started. And Liz and I connected because we were going through similar life transitions, and we were like, this can't be sustainable for people. Like, let's not just talk about our problems, let's bring solutions. So then that just really kind of snowballed into what we do.
Okay, awesome. And I'm looking forward to digging into all of that. I took some
Yeah.
notes so I can bring them back up later on.
Yeah.
So before we get into everything, what does public health mean to you?
Public health means to me an empowerment of the people, in the sense of taking healthcare and taking your health journey, because it is a journey, into your own hands through education from professionals. So I really like to take the angle of giving people resources and helping them understand where to find resources in order to do their own research and educate themselves, so that they can live a healthy life and prolong their journey.
Yeah, and I think that's key. Just having community and empowerment and at the center and the forefront is so important. So
Yes.
you said you went to PCC, Pasadena City College. You entered there undecided. Was that correct?
Yes.
Okay, so what was the thought process for going here in the first place?
To be brutally honest with you, I didn't want to go anywhere from home and or too far away from home. And I grew up in Pasadena, California, so that was home to me. And then the undecided piece of it, I just wasn't sure what I wanted to do. I knew like I said, I wanted to be in something nutrition health field, and PCC was the closest city college to me.
Okay, awesome. What was that experience like going to that school?
I did not like it. It was kind of like being shuffled in like cattle. It just was like you get in these lines, and also, granted, this was many years ago, but just trying to add classes, I would be on a wait list of like 50 plus students, and just hoping. I remember sitting in the hallway outside of my sociology class, hoping I would get added, and I wasn't. After 2 weeks of sitting there waiting to be added, it just felt very overwhelming, and it's frankly distracting from the learning experience, because you're more concerned about trying to get the classes that you need than actually learning and being educated.
Yeah, and that definitely sounds like a challenge. So how long were you in Pasadena City College?
I was there for a year.
Okay, and then so what was the deciding factor? What made you want to go to La Sierra University and pursue your Bachelors of Science in Health Science, or did you switch there and were you still undecided?
So when I went there, I was pre-nutrition. Okay. So I had by the end of PCC actually solidified the fact that I did want to go into nutrition and health and wellness. The deciding factor to go to La Sierra, I actually, for a lot of personal reasons, I needed to leave that area in Pasadena, and La Sierra is about 45 minutes from Pasadena. So it's not super far, but it was far enough. And I started dorming there, which was a cool experience. And La Sierra, I went to San Gabriel Academy for high school. It's a Seventh-day Adventist academy, and La Sierra is a Seventh-day Adventist university. So there are sister schools all over the U.S. So it was also one of the closer ones. I still wanted to be closer to home, but also out. So I started there and declared my first major in pre-nutrition.
Okay, awesome. And I don't think I think I said this before, but it is very common for people, especially in like the US Canadian system, to switch majors like 4 to 5 times. That's like a norm, I would say. So.
Okay, is it? I didn't know that. I'm so glad to hear that. Thank you.
Yeah, it is. So tell me about those transitions in majors. You don't have to, I don't know if you remember all of them. You don't have to
Oh,
mention
I
all of
do.
them. But what was like the thought process for like switching majors, and tell me about that.
Honestly, it was to avoid like certain classes that I didn't enjoy.
Mm-hmm.
And I hate saying that because it sounds so shallow and immature, but that's where I was. And that was my headspace
Mm-hmm.
at that time. And I went from, so I started as pre-nutrition, and then I went into, I did not like the chemistry classes. And then I went into um, social work, because it was sort of translating into like I always wanted to stay in the helping underserved communities and access and
Mm-hmm.
literacy and all of that. So I did social work. I went into bio, and then I went back to nutrition. Okay. And then I went into health sciences. That was my fifth and final.
Yeah. Okay, that's awesome. And what did health science, like, was this, did you choose this because it wasn't like as sciencey in the sense that you don't have to take like high level chemistry classes and those kinds of things, or was it that you enjoyed like the public health part of like health sciences?
So that's what it was. And it was a combination of both. I'm not even going to lie. I was like, sweet, I like this major. I like the content, the course curriculum and structure, but I also really like the fact that it includes and encompasses all of the, the types of demographics that I was looking to serve. And I had actually become very close with a family that was very struggling with food accessibility, with socioeconomic struggles and disparities. So it really became a kind of personal point for me where I really wanted to serve that community. A young mom had a baby, and we became friends, and we're still friends to this day. So that's where I really started to hone in on that interest.
Okay, awesome. So were there any big takeaways that you had like going into your bachelor's, well, ending in your bachelor's of health sciences that you wanted to share?
I think the biggest takeaways are courses. I think classes should be part of a degree that are going to highlight what you'll actually be doing. If that makes sense. Like
Mm-hmm.
some of the courses were like, well, you have to take this and this and this to meet this, credit amount and elective, and you can pick whatever you want. And you're just feeling like you're spinning your wheels sometimes.
Mm-hmm.
And the last part of like the last year of that was a very pivotal year for me because the course content dug super deep. We didn't have internships at the time, and I really, really wish I did an internship. But it was a very eye-opening experience for the classes that I was taking because they were so honed in on what I wanted to do.
Okay, and why would you say you wanted an internship during your bachelor's?
Because I feel like it would have been a good opportunity to do some field experience. I actually finished at the height of the big crash in 2008, 2009-ish.
Mm-hmm.
And when we were graduating at the time, there were literally no jobs. It was like a hiring freeze across the board, and you're left with this giant financial burden on top of the fact that you have your degree and you were told your whole life, get your degree, because it's gonna, increase your chances of getting a job. And so you're like, tunnel vision to this degree. And then all of a sudden there are no jobs for you. And I ended up going back to working retail after I graduated for about 2 years. And it was very detrimental. So all that to say is the internship really helps you kind of gauge your interest on what you want to do, but also sets you up for networking, which is important.
Yeah, absolutely. I absolutely agree with that. So tell me about, so you had to work in retail, and then from retail, I'm guessing that your next job was the admissions representative administrative support for Northwest College.
Yes, yeah.
So tell me about I guess the mindset that you have to have being in retail for 2 years, looking for like a job more in aligned with like what you were interested in doing?
Yeah, so working in retail, I don't know if anyone's ever worked retail. It's it's exhausting, and there's a level of burnout that you experience. So I was doing that for a while, and then when I finally got this interview at Northwest, I was like, "Sweet, I'm about to have an office job for the first time," and I felt so cool. I could dress up every day and go to work. But I saw it and I thought, okay, these are working with some of the people that I knew I was interested in working with. It was aligned with the fact that it was a healthcare vocational school. So I thought, okay, I could get some exposure here, learn about some of the college admissions process, transcripts, course curriculums, and things like that, and kind of network within it. I'm always thinking about how can I learn from this, not just from what I'm doing on this level, but how can I, dig a little bit deeper and make connections here, there, and who can I meet? So it was kind of all of that.
Okay, awesome. So how did you come across this position?
I found it on, oh my goodness. I think I found it on, it wasn't Indeed, because I don't know if Indeed was a thing back then. It might have been Monster. Monster. Does anybody use Monster anymore?
I know it's still out there. I don't know if
It
people use
is.
it still.
Okay. I think it was on Monster.
Okay, awesome. So what did you do in this role?
So I screened applicants to vocational programs like medical assistant, licensed vocational nursing, surgical tech. I screened applicants coming in and then walked them through the admissions process. So I would give them a tour of the campus. I would go over the program structure with them and then help enroll them. Once they started, that was kind of on to the academic side.
Okay, that makes sense. And how long were you in this role?
I was there for a year.
Okay. And so after this role, you went on to get your Masters of Public Health.
Mhm.
When okay, did you know about public health per se, like from your bachelor's doing like health sciences, first of all?
I did. It was a few, actually a few professors I had spoken with uh, encouraged me to look into that or social work because of the fact that I was really interested in working with communities and specific demographics related to maternal health. So a few of them had uh, had recommended it to me to look into once I finished. And I was actually looking for an MSW program before I looked into public health. And so when I reached out to Grand Canyon, I asked them if they had an MSW and they said no. But for what you're looking to do, look at the curriculum for the MPH. And I was looking at it and I'm like going down the list and I go, oh my goodness, this is exactly what I want to do. Unfortunately, they didn't have the emphasis for maternal child health. So that's why I circled back and did a lot of like, small courses to specialize in that.
Okay, and tell me about that process of it seemed like you reached out to universities to find out like
Mm-hmm.
what they had. Why did you do that specifically, or like what was the reason behind that?
I'm a deep researcher. I ask questions, and so I don't just find one thing and go, okay, that's what I'm going for. Or I don't take one recommendation and just go for that. Um, so I take all of my options and then kind of weed through what sounds not only credible, but accreditation is super important in higher education and accrediting bodies, and there's a whole science behind that, but that was really important to me. And the the resources that I would be able to have attached to that. So that was kind of my thought process. So I researched a lot of schools.
Okay, okay. Well, I'm glad that you found your MPH and you went into that. So tell me about tell me what you learned, like any like big takeaways throughout your MPH program. I know you said that there wasn't a maternal health track. So
Yeah.
like how did you cope to deal with that?
I was okay with that because I figured it was good to have a broadened scope on the public health field. and the diversity in course curriculum was more than enough education for me. The after fact of my internship, I did an internship briefly to get it was like to get your hours for the practicum with an organization that no longer exists, but it was up and running to serve single moms that were below the poverty level. So I did a lot of work with that, and then I did some hours with Reach Out, and they're still in existence, but they help at-risk youth from families that are under the poverty level as well. So that was those were both great experiences. I think the biggest takeaways were those two experiences, being able to like really put my boots on the ground and kind of dig into those demographics.
Okay, and were those experiences that the college gave to you, or did you have to go about and seek those out for yourself?
I had to seek them out.
And tell me about that process of looking for organizations to intern with.
That was challenging, honestly. Now that you bring it up, I haven't thought about it since then, but it was pretty challenging, making sure that they were going to have enough for me to do, and I wasn't just going to be their admin assistant and like, data entry or whatever it was. Like I wanted to actually be of use. Mm-hmm. And so I know for a few of them I reached out to, they were like, well, we don't really have anything, or we don't have a program like that, or there are a lot of, it's quite surprising. A lot of these types of entities do not have programs like that to help grow young professionals in these fields. And I think that's something that we could really use.
Yeah, I agree with that. I think there are a lot of issues with like the public health pathway to get into career jobs in public health. Like if you look at like any other health related fields, there's so many different like programs, pathways that you can find out about, and that is not the case with public health.
Absolutely.
Unfortunately. So after your during your MPH, you were also an admissions coordinator and advisor for West Coast University. Yes. So how did you find out about this position?
So I found that on their website. Actually, I was Googling universities because I had already had that year of experience in higher education. Mm-hmm. So I started Googling universities, and I started there early 2012. I found them, applied, and yeah, the rest is history because I'm still there.
Awesome. So what do you do? Well, a little bit like, I guess, which programs do you do admissions for, and what have you learned from this, like being in this role?
So the admissions coordinator was my gateway position there. I left and I moved to Maryland for 2 years. When my husband got a job out there, he's from there. We came back, and then I started back there again. My old regional manager reached out to me, and she's like, come back. So I came back as an admissions advisor, and right there we were primarily focused. That campus specifically had pre-licensure nursing program and accelerated Bachelors of Science in nursing. So what I would do is host information sessions for groups or one-on-one, go over the curriculum, class structure, scheduling, and kind of educate these people on what this program entailed and the process and how to get admitted. So that was primarily my focus on that position. And then now I'm a business development representative.
Awesome. And we'll talk a little bit about that in a little bit. So after that role, you went into a role as an academic placement advisor for Connections Education. So how do you get this one?
That was in Maryland. So I got married, and then we moved to Maryland, and it's actually where I met Liz. Yeah. So I got that position. They actually reached out to me, and I believe it was on LinkedIn.
Okay, awesome. And tell me about how did you meet Liz?
I met Liz. So actually, she and my husband were best friends. At their job. Mm-hmm. And they were working together, and I actually met her when she came to our wedding out here in Cali. So she was invited, obviously, and then I met her like in the middle, but after the ceremony and before the reception, like during cocktail hour. Mm-hmm. And then when I moved there, we became friends because we saw each other all the time. I was going to their workplace quite often.
Mhm.
And yeah, that
All
was in
right.
2013, I think, 2014.
All right, everyone. Hear that? Key insights. Get your future fiance, husband, wife to have a work best friend, and they will start a business with you.
I know, right?
That's awesome. That's awesome. And then after this role in Maryland, you were holistic nutrition coach, functional medicine at the Institute of Integrative Nutrition. So first of
Mhm.
all, what is functional medicine?
So it was holistic nutrition, which integrative holistic nutrition is what the cert is called, and it encompasses whole person care. So your health and nutrition journey is not complete until you've addressed all of these other areas in your life. So
Mhm.
there's multiple different pillars, like your spirituality, your financial wellness, your relationships, etc., that go into your full holistic wellness. And that is really something that I decided to pursue because I needed that. Again, I was coming from a place of what I needed and educating myself. And I'm like, listen, I could totally help other women do the same thing. So that's where my thought process came from that.
Yeah. Okay. And what have you? How have you used this in your career thus far?
So I feel like it's really strange because my current role, like in my job is completely different than what I do for my business. And so I've used that in many ways that has translated into my job, uh, because it's a I feel like there's not enough awareness around the holistic um, space in public health. There's, or in health in general, there's take this medicine treats this, and you go to the doctor for this, and this is this. But like, what are we helping educate on? So that's how it's helped me. Like, kind of, I work with nurses, I work with healthcare professionals a lot in my full time job, and that's something that I find joy in being able to talk to them about. And it's kind of like, oh yeah, we all have this aha moment of that holistic perspective.
Yeah, and I think it is so necessary to have that holistic perspective. Like for me, I wanted to initially become a doctor, MD doctor. Then I switched to DO doctor because I thought that was more holistic. Then I
Yeah.
got into my MPH program, and I'm like, this is not for me.
Mhm.
I'm gonna become a public health professional and like really try to drive like systems change and really focus on like the holistic things because when we hear health, we usually just think about hospitals or
Right.
health or health care just in general. But there
Right.
are so many other things as you spoke to, like financial, relationships, spiritual. So I
Mhm.
think it's so important to have that perspective and to advocate for those kinds of perspectives in
Yes.
public health for sure.
Mhm.
Now we're going to talk about WMC Public Health Consulting, where you are the founder and CEO. So I know that you were the driving force behind starting it. So do you just want to dig deep and tell me about that like story? Because I know you were talking earlier about like having anxiety and all of those things. So I would love to just hear more about that and dig in from there.
Yeah, so I went back to work after I was blessed enough to be able to stay home with my son until he was about 10 months old. My husband had started nursing school when he was about 6 months old. So that was like a 4 month period of where I became, aware that this position that was open, and they asked me to come back. So I went back, and I was not at all prepared for the challenges of working motherhood. And I think that is something that needs to be addressed and talked about a lot more, as far as it goes and affects your health completely. But just to kind of take you back to that moment when I created the um, Working Mama Collective group, was I was driving home. I was sitting in traffic on my way to work daily. And then I was sitting in traffic on my way back. And there were times when I would make it back and he would already be asleep. I would have missed dinner. I would have missed bedtime. And those are things that to me are super important that I'm present for, because those well, there's a million bath times, there's a million dinner times, but it's those little moments that I feel like really shape them as they grow. Um, So I was missing a lot of that, and it started to wear on me because I'm like, well, this is what I'm supposed to do. I saw my mom do this. She was a single mom. She's an amazing hard worker, but I saw her do this day in and day out, and I'm like, okay, well, this is how it's supposed to be. So one of those times I'm driving home, I'm sitting here listening to a podcast, and it was like an hour had gone by, and I'm about to exit, and I just start bawling. I'm like crying. And I really felt like I can't do this anymore. I don't feel good. I don't feel good, right? There's a not feeling good mentally and a not feeling good physically. And I was both. I was like not
Mhm.
feeling good at all. And I came home and I told my husband, I said, I can't, I need help. And I don't know what kind of help I need, but I need some sort of help. And I know I feel isolated and I feel like I'm alone in these feelings, but I know I'm not.
Mhm.
So when I started this group, I mean, all of us were having the same conflicting feelings, the same burnout, the same, there was a lot of camaraderie behind it. And so when Liz and I started talking about these things, I said, we both said to each other, okay, we're talking about everything that's wrong, but how are we going to fix it? How are things going to get better if we're not creating solutions, and we're both very solutions oriented, and we're not the type of people that are just like complaining without bringing a solution. So that's where WMC PHC was born.
Okay, and tell me more about the timeline of you and Liz's friendship and like building out this thing. Like, when was it an idea? When did it shift from an idea to like, okay, let's stop just talking about this and let's create
Yeah.
solutions? And was that
Oh
initial
yeah.
group also like a Facebook group?
Yes, it was a Facebook group.
Right.
So that I had created, it was like early 2018. And then Liz and I had started talking about this probably about 2018, 2019. We were talking about like our similarities and how we were feeling. And then when we actually executed, it was summer 2019.
Okay, and what was the vision for it coming together? Like, what did you all always think? Okay, we wanted a nonprofit, or how did that go about?
So we wanted a nonprofit because we wanted to be able to offer these resources to anyone who needed them. We wanted to be accessible, which is something we're really big on. We're actually in the process of changing over to an LLC. And we just decided that we were going to do that a couple of weeks ago, and we're going to keep a nonprofit leg. Um, but the reason why the services we created and started offering were important to us is because they were ones that we needed.
Okay, and I love that you said that. Just because I didn't know that you were thinking about this, and this is something that I love to talk about. So initially, so you said you wanted to have a nonprofit, not a for-profit or LLC, because you
Mhm.
wanted it to be accessible. Can you talk about like how that accessibility is like stopped from when it is like a solely for-profit organization?
Yeah, so that's why we went back and forth about this often. And and like businesses and anything, you should really evolve and learn to grow as you see fit. And the nonprofit piece of it is still very near and dear. And but the main idea behind it was so that we could offer our services to anyone, because we have the corporate services, but then we also have the direct to mama or parent services, the coaching services. And we didn't want anyone to say, well, I can't afford that, like I'm not going to be able to do this. But you still, there's still the need that needs to be met, right? So going to the LLC gave us a little bit more freedom, like logistics wise. And then having the nonprofit leg of it still enables us to serve anyone.
Okay, and does that add more tax complications for you all in like business wise?
That's a good question. Liz and I were just talking about that yesterday. And these things are going to start changing a little bit for us. And our business is based out of here, the state of California, and there are a lot of regulations for nonprofits. So it almost is like a trade-off. Like, are we willing to, do we want to like have this laundry list of things and criteria that we have to meet, or do we want to, kind of simplify our process and then like worry about that tax details on on the back end? So we were like, we'll deal with that on the back end instead, because there were just a lot, and we had a board of directors, which you have to have in order to have a nonprofit, and that became challenging as well. So we just honestly like hashed it out over pros and cons, and that was the winner.
What was difficult about the board of directors?
Oh, wrangling everybody together for board meetings. You know, that equal passion for the project is it's hard to find, especially when you're not being compensated for it. And I think that had we started out a little bit stronger with with that and the responsibilities behind it, I think we would have had a little bit more success with it. But the main thing was wrangling everybody together and getting everyone's schedules on. Everybody's on multiple sides of the East Coast, West Coast, Central, and it was wild.
Yeah, and that's a key tip there, because it is very hard to organize those kinds of meetings, especially with people that
Yes.
are all over the place and have
Yes.
varying like work schedules, and they're involved in a bunch of different other things. So
Yes.
take warning, everyone.
Yes.
And so tell me, was the idea to create the LLC side of the company to better reach like the corporate wellness side of things, or what was the thought process for that?
For the nonprofit side or the
L-
LLC side?
LLC side.
Oh, it was for both. Um, Aside from the fact that we didn't want to, have our BOD um, take time out of their day. If it wasn't something they were truly passionate about, take time out of their day. And every 45 days we had to have a meeting, or 90 days, I think it was, we had to have the meeting, which is a requirement, by the way. The BOD has to meet. Um, so the LLC just kind of simplified the process, especially for payment of services. It simplifies the process there. It simplifies the process of Liz and I taking our salary or our pay out of it, because we're using our time and investing our time in this, which is going to eventually be our full-time job. Right now it's like our 3/4 time job, because I don't even want to say part-time. We spend a lot of time on this. So we wanted to simplify that process and make sure that we were doing ourselves due diligence as well, and really realizing that vision. And sometimes it means pivoting. So that's where we saw the biggest benefit.
Yeah, and that makes a lot of sense. And I think it is important as organizations, nonprofit or for profit, to be able to pivot and make those changes as you see necessary.
Mm-hmm.
Do you want to talk a little bit about the services you offer on both the corporate wellness side and like direct services?
Yeah. So for the corporate wellness side is we help, I know it sounds like, we really love to build out the corporate wellness programs and offer it to businesses if that's what they need. But what we mainly will do is speak with a business and see what their needs are, because not every business has the same needs with their demographics. So whether it's onboarding someone, like, hey, we have an employee that's coming back from maternity leave, will you just have a conversation, or have whatever it is that this individual needs to come back in successfully, kind of get coached throughout their time, maybe whether it's 45, 90 days back into their role, and then kind of go from there. Those type of services. So we like to call those micro services. And then we also like to build and create resources for an employer. So, when you go into a break room, when you're actually back at work, you go into your break room and you see all of these signs like whistleblowers, this or this number to call and this number to call for this. So we're actually working on those type of resources. If you need, do you need help, strategic planning, family life planning, or building work-life balances or work-life boundaries, you can call WMC. So these are things that, we're working on to provide to employers. For direct services to the direct to consumer, we're also working on microservices for them as well. So whether it's holistic nutrition coaching, I know Liz is working on some postpartum coaching, which she really, really loves to do. We're working on some of the strategic planning with working moms, and we're actually just both of us looking into the childbirth education piece of it, because while you're working in your pregnancy, your health is like your game has to be boosted, and postpartum and however long that lasts. So it's something that we're looking into adding to.
Okay, awesome. And I look forward to seeing that. So how do you speak to employers to advocate for the importance of like work-life balance and those sorts of things?
Yeah, so Liz and I have a great dynamic because she has a deep background in corporate wellness programs. And she was actually working with one of the counties back of where we used to live in helping them create their wellness program. So she speaks to them quite a bit more often than I do. So she lives on LinkedIn, and we talk about, just kind of asking, what are your needs? We start out with a survey, always. We start out with data collection and kind of going from there and helping them identify, okay, you have a problem with retention for your employees, your working mom employees. They're not coming back from maternity leave. Why? Are your hours flexible? Do you have flex work options? Do you have part-time work from home options? Like, are you working with them, or are you very rigid with your 9 to 6 and you cannot go outside of that? And that is a dying mentality. And that is something that a conversation needs to be had with employers all over the place, with the fact that those are not sustainable anymore for parents who want to be deeply involved in their children's lives.
Yeah, absolutely agree with that. Definitely needs to change, and I hope that that change does come soon.
Yes.
So I know you all at WMC recently launched a podcast. So what has that process been like?
Oh my goodness, Amari. I have to be honest with you. So I told Liz, and that was the project I was working on. We had been talking about it, by the way, for about 1.5 years. So I'm going to be honest with you. When you're talking about something that long, you just got to go. And we're both perfectionists, and we're like, okay, Liz is definitely a perfectionist. I'm a perfectionist to a point where I just get annoyed with myself, and I'm like, all right, I just need to do it. So we actually, it took that long, by the way, but so towards the holidays, these 2020 holidays, I was about to have my son, and my second one, and told her, I said, I got to get this up before he's born. Meanwhile, I was 2 weeks past due, so I guess I had more time than I needed. But I had given myself a deadline, did not finish it because I was lost in Googling how to do this. And by the time I actually made my way around back to a host and a platform and an RSS feed and getting it validated on Apple Podcasts, goodness, we launched just before the end of the year and then aired our first episode in the new year. So that being said, it was a wild ride. There are 2 people that helped me out. So I'm so very grateful for them, because Leonore actually is one of them that helped me. And then Dr. Huntley, she helped me. Yeah.
Okay. Awesome. And where can people find your podcast, and what is it called?
So it's called Working Mama Collective, and they can find it on all platforms. It's streaming everywhere.
Okay, awesome. And what can people expect to hear on the podcast?
Oh, real conversations. Liz and I would probably have at least 500 episodes by now, because we should just record our conversations on the phone. But they can expect to hear us talk about wellness as it pertains to manifestations of health outcomes for working moms. So burnout, how does that affect your chronic issues, acute healthcare issues, who to talk to and how to speak to managers to let them know what you need, creating boundaries. We recently had Dr. Stoletny, she's a psychiatrist who specializes in burnout and the science behind burnout in professionals. So we just had her on. We talk about a lot and everything within that little sphere.
Okay, awesome. So definitely check that out, everyone. So tell me a little bit about your partnership with Liz, because if I'm not mistaken, Liz lives in North Carolina,
Yes.
and you're in California. So
Yes.
how has that dynamic been? Just like having another partner who's like on the other side of the country, and working together on this wonderful nonprofit and LLC.
So there's a lot of addition and subtraction, and the reason why I'm saying that is because we have to like use our fingers to count down the time difference. So if she's like, oh, 3 p.m., we're like Eastern or Pacific. Like that's literally in every single conversation we have, Eastern or Pacific. And we're like, okay, 12 o'clock, 11, 10, 9. Okay, 9 my time. So there's a lot of that. And then we constantly talk every single day. And we're actually like friends before business partners. And we talk about our personal lives and things that are going on. Um, so it's such a joy to be able to work with someone who you align with like that. However, we are so different, yet we blend so well because she has strengths in areas that I'm not so strong in, and I have strengths in areas that she's not, and we complement each other very well. And we were just talking about that. Like we always tell each other, I'm so grateful for you, because because I'm responsible for social media, like our Instagram and Facebook. And if I'm having a creative block, I won't post. I don't just post to post for no reason. And she'll pick up on stories. She'll just add stuff to stories. And so it's cool because we just have each other's backs, and we know we can be honest with each other and get on the same page if we're not. So it's been awesome.
Okay, awesome. And if someone wanted to follow along with WMC Public Health Consulting, I know that they can find your podcast. Where else can they find you?
So they can find the podcast on all platforms. They can find us at wmcpublichealthconsulting.com. We will be changing our name though. When we change to LLC, it's going to be WMC Health. So look out for that domain change. Instagram, we're at theworkingmama.co. And Facebook, if you search in groups, it's Working Mama Collective.
Okay, awesome. And do you still have that original Facebook group that you started?
I do. Yeah, it's still there. It's still there. We are using that. It translates and talks to our Instagram. So there's a lot of that. And then there's a lot of question like pop-ons and stuff like that. We do have our Instagrams for Liz. She has hers. It's at Lizzie_Marie. And then mine is at Simply GNV Wellness. And that's where we kind of like talk about our specific niches. And then like it all funnels into WMC.
Okay, awesome. Is there anything else that you'd like to share with the listeners about WMC, or anything that you all are doing in the near future or anything like that?
Yeah, so I did mention the childbirth education. So Liz and I are looking to start that up together sometime in spring or late spring. But whatever business, if you're thinking of starting a business, especially in the public health field, do your research with the type of business that you want to establish, but stop thinking and talking about it. Just do it. Know who you want to help, know who you want to serve, and fly. Do it.
Awesome. I like that a lot. I like that a lot, because a lot of the time we do have like a lot of thoughts in our head about, oh, this could be something or that could be something. And we could even sometimes like talk to people about it. And one thing that I've been learning is like, you can't always talk to people who have small minds, because they're going to shut you down, because they just don't have the mindset to view it. Like I was,
my goodness.
so definitely
this emoji.
yeah, so definitely like if you think it's possible, it's definitely possible. Be around the kind of people that are going to support you and push you to do the things that you're trying to do. And remember that a failure is never a failure. It's just like a learning lesson. So just keep.
Yes.
Yeah.
Yes, absolutely.
Did WMC have any like failures or like failures, I say in air quotes, that you all overcame or overcoming?
I will say the website situation, when we first started developing the website, we hired a developer, sent them everything that we wanted. We were very detailed. Um, and it turned out like nothing that we wanted. And so Liz looked at it, she opened it. I go, it's ready. She looks at it and she texts me, she goes, ew. That's all she said. Ew. And I said, my thoughts exactly. Let's we gotta clean this up real quick. So I actually have a very good friend of mine. She lives in Arizona. She was able to she recovered the entire thing. It looks awesome now. But that is one thing. And then I honestly think knowing that you're going to mess up, setting the expectation that you're not going to do everything perfectly will definitely help soften the blow. And it's definitely not, the failure part of it. It's the oh, okay, maybe I shouldn't do that way. It's a learning experience, because then in 5-10 years from now, you're going to help somebody that was starting at point A, and you're going to know and speak from personal experience and help them. So there's a reason why we go through challenges like that. It's really to reach back and help somebody that's about to experience the same thing.
Yeah, that is absolutely great insights there. So I guess we're done with WMC Public Health Consulting for today, but definitely check them out on all platforms, everyone. So going back, you said you worked as a business development representative at West Coast University, and you said you got promoted into this role.
Yeah. Yes.
Yeah. Did you have to re-interview, or was it just like a solid promotion?
Sort of, yeah, because I had it's a completely different department as a whole. Because West Coast, we have ground programs, which are the pre-licensure programs, and then the online programs, which are we do have masters, but those are, you have to already have that degree in place. So yeah, so I did just kind of get it. I did speak to one of the like a couple levels above the hiring manager once, and then that was kind of it.
Okay, awesome. So what do you do in this role?
So the business development role, I am responsible for community penetration. And when I say that, it's I'm responsible for hospitals and facilities learning about our education resources. So we have these online programs. I'll go to a director of education or a CNE or CNO of a hospital and say, these are some of the degree programs. Are your nurses or are your healthcare staff looking to advance their education? And so with that conversation then leads to, how can I help bring these degree program options to their staff? So we'll host lunch and learns for their staff. We'll leave flyers in their break room. We'll work very closely with the directors of education in each facility. So I have about 15 to 20 of them in my area that I work with. And then we also are working with schools. So creating articulation agreements, helping community college students translate their credits over to West Coast, and how can they filter in a streamlined process. So yeah, that's primarily what my responsibilities are.
Okay, and where is West Coast University?
So we have multiple campuses. So there's the online sector that I'm a part of currently. We have a Dallas campus, a Miami campus, and then 3 in California. We have the Ontario, California campus, Anaheim, and then Los Angeles.
Okay, and what really got you interested in like working in higher development, higher education, I should say? Sorry.
I love learning, and I love I was joking with Liz the other day, we're gonna have 60 acronyms after our name by the time we're done, because we're just keep going back for certs. But I find so much value in continuing education. I find so much value not just for the person, but for what they can offer. And it's a means, it's not a means to an end, because we're constantly learning, and why shouldn't our education follow, is my thought process. So, and it helps hospitals for sure, when their staff have a certain level of education, and it just helps with their growth also, because I like to see people in my life grow,
Mhm.
and that brings me a lot of joy for them. So when I'm meeting, some of these nurses or healthcare staff in the field, and they're like, oh, I've been thinking about my nursing, getting my master's, or I kind of want to be a nurse practitioner, I want to teach. And I'm like, okay, awesome. Let's go for the FMP, or like, let's look at these options for your nurse educator leadership role. Like, that's what I like helping people do. That's my favorite part of the role.
Okay, that's awesome. And how do you balance this role and working in with WMC?
So I just returned from maternity leave like a couple of weeks ago.
Mhm.
Um, and for the past 6 months that I've been off of that full-time job for business development, I have been working very hard. Like, this is like WMC's the full-time job. And I knew I was going to pour my heart and soul into that to make sure that we had some things that were automated. So for that, I was focused on 100%. And then now that I've come back, it's been a challenge to really navigate my time for that, because I do not want that to go to it's not a hobby for me. This is definitely the end goal. So I, after hours, after work, because my job is pretty busy. And then on top of it, I've got the baby, and then the 5-year-old busting into meetings, as you saw before. Um, so yeah, Sundays, Saturday evenings, and then the evenings during the week.
Okay, and when are you hoping to go full time with WMC? I'm not going to tell your employers.
No, that's okay. I'm totally honest. Like, I don't feel like I have to hide anything. Everybody has a life outside of their full-time work. I was just talking about that with my husband. I think that you know, I'll know the time when it's right. And I don't like to say, oh, by summer or by next fall, because when that time comes and it's not happening, it doesn't mean that it's not going to happen. So for me, it's more of when I start to feel at peace that this is it, like this is the time, then that's when I'll do it. And I won't think twice about it. As long as I'm thinking twice about it, I know it's not the right time.
Okay, that's awesome. That's good that you have like a dedicated conviction to like your mindset or like just doing something. So that's awesome.
Yes.
So you got a certificate in integrative nutrition.
Mm-hmm.
So where did you get the certificate? Why did you get it? And then what did you get from it?
So the Institute for Integrative Nutrition, it's IIN. I actually heard about them on a podcast that I was listening to a few years ago, back in 2017. I didn't have the time to do it at the time
Mhm.
then. So, when the opportunity came up in a window of opportunity, I snagged it. And it taught me a lot. And I think most the most valuable takeaway I got from that was bio individuality. So not everybody, not every health uh, recommendation, not every medication, not every food, lifestyle, or diet is right for everyone. And I am a full believer in that. And that is partially why I really take pride in educating people on what their options are, because my sister-in-law can be a complete vegan, and I can try and be a complete vegan, and it does not work for my body. Or we could have the same chronic illness, and she can take this medication, but I cannot. Those are things that I feel like need to be a little bit more normalized, because not everything is right for everyone.
Yeah, and
So that's what I got out of that.
yeah, and that's very important, and I feel like that is a shift that the medicine field is taking, like more personalized medicine.
Yes.
So it will be interesting to see how that goes. What would you say have been some of the benefits of getting like all these certifications that you have?
I feel like a well-roundedness approach, but in a specific way, if that makes sense, right? So you get your education, you get your bachelor's degree, which is super well-rounded. Your master's degree is a little bit, more focused, but then your certs are kind of like that meat and potatoes of what you're learning, and it really offers kind of those micro pieces of information that cause that ripple effect to affect that that greater opportunity of learning and educating. So I really do feel there's a lot of value in certifications.
Awesome. And that was a really great explanation. So thank you for that.
Okay.
Where would you like to see yourself in the future?
I would like to see myself being a resource for women like me, and I would like to see myself educating um, women like me who are in need of a village and who are in need of, not scouring the internet for something. Like, I want to be somebody's go-to and be like, oh, you know what? I know Gianna actually knows about this particular whatever it is. And that's kind of where I am right now, but I want to be that on a little bit bigger level, and just being an awesome mom, like present, and where they're not like wondering when I'm coming back or is mommy in traffic. Like, no, mom's gonna be home at this time, and she's always home at that time.
Awesome. And I look forward to seeing you develop that
Thank
greater
you.
acumen. Yeah, yeah, of course, of course. And I definitely I feel like we should definitely have WMC on the show sometime, so you and Liz together. We can
Yeah.
talk in like next couple of months or something. And I think
Yeah,
that'd be awesome.
that'd be awesome.
All right, I'm gonna hold you to it. It's on the podcast now.
Let's do it. We recorded it. It's happening.
Awesome. Awesome. So moving on to the last section of the show, the Furious Five, the 5 questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
I would give them, the biggest thing is start to know who you want to serve. Start to figure that out, because when you figure that out, that'll lead you to your place in your internship if you take one, and to see if you like it, so you don't end up in a job first that you don't like and you're backpedaling. So figure out the demographic you want to help.
So, number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Into my position as a business development
Yeah,
or
and
WMC.
let's do both. Let's do both.
So for a business, stop thinking about it and start talking to people who can help you. Networking is huge. It is key. And then for business development, again, networking. That is how I navigate this entire position.
Awesome. That's great advice. So number three, what's something you are working on improving in your life right now?
I am working on improving understanding my boundaries and my triggers to anxiety. So, learning to know when to stop, and that the world will keep on spinning if I don't do this one thing at this specific time. So, just learning to create those boundaries for myself.
Awesome. Number four, professionally, do you recommend anything?
I recommend knowing who's in your corner, and knowing who you can talk to about your business ventures and who you cannot, because there are people who love you and support you, but then there are sometimes those same people are not in that same mindset, as you kind of mentioned it earlier. You've got to have a crew behind you that's gonna help you understand your power and help you leverage that power into what you want to do, and not hold you back through fear. So really, really honing in on those people in your life.
Yeah, that's hugely important, building those relationships that matter for sure.
Mm-hmm.
And
Yes.
last but not least, where can people connect with you?
You can find me at Simply GNV Wellness on Instagram. Also, you can find me at theworkingmama.co on Instagram. And then our email collectively is WMC Public Health Consulting at gmail.com.
Okay, awesome. Well, thank you so much for taking time out of your day away from your kids and your new baby to be on the podcast. I really appreciate it.
Yeah, thanks for having me. This was so much fun. I was really, really excited. I woke up extra early this morning.
Well, I'm glad that I could do that for you. And I appreciate you. And I definitely will just stay connected, and we'll definitely do some more stuff in the future.
For sure, for sure.
Well, I hope that you all grabbed some valuable insights from Giana today. I know that she really shared some great insights on her journey and how she pivoted and dealt with things and really found a need and created a company where she found a need in her life. And I think that is very applicable to any people out there that are trying to go into public health, entrepreneurship, or anything of that sort. Definitely just find a need that you are seeing in your life and create that solution, and then grow that to scale. That's a great way to do it. And I was happy to hear about the process of them transitioning from a nonprofit to a nonprofit with a LLC arm or a for-profit arm, and I'm looking forward to see how that unfolds. And definitely we'll have to have them back on in the future. So be tuned for that. Be tuned in for that, and definitely subscribe, like, review. Appreciate you all. Talk to you all next week. Public and Millennial out.